Okay, so the webinar is starting.
Welcome, everybody, to the Morning Scoop presented by the Arizona Capital Times. I'm Steve Goldstein. Our discussion this morning is Navigating Dementia, Arizona's innovative new model. And we have a great group of panelists, including Sherry Friend, President and CEO of Oakwood Creative Care, John Giles, who's the mayor of Mesa, Todd Sanders, President and CEO of the Greater Phoenix Chamber, and Martha Smith, President and CEO of Arizona Complete Health. First of all, thank you all for joining us this morning for this Morning Scoop. Appreciate your time.
Thank you.
So I'd love to have you all introduce yourselves before we get into all the details of our conversation and give a bit of information, just a little bit, on why you're on the panel and why you think it's important. Sherry Friend, can I start with you, please?
Sure. Sherry Friend, President and CEO of Oakwood Creative Care. I have been in the nonprofit space helping seniors live their best lives for over 25 years now. So super passionate about this topic. It is kind of my life's mission. So I'm excited for this conversation today.
Perfect. Thank you. Martha Smith.
Great. I'm Martha Smith. I'm the President and CEO for Arizona Complete Health. We provide Medicaid and Marketplace and Medicare coverage for about 600,000 Arizonans. And we were recently awarded the contract by Access to serve our All-Tex members in the state. And with Arizona having one of the fastest growing rates of dementia and Alzheimer's in the country, I just feel like this is a really important and timely conversation for us to be having. So thanks for hosting.
Great to have you here. And Todd Sanders.
Thank you, Steve. Good morning. In my day job, I'm President and CEO of the Greater Phoenix Chamber of Commerce. We're dedicated to work in policy area, economic development, and workforce. But I'm here this morning really because of an experience I had with one of my parents and dementia, and I know we'll be speaking more about that. So I'll turn it back over to you.
Thanks. And Mayor Giles, last but not least, what brings you to our panel?
Thank you, Mayor Giles from Mesa. I think probably like Todd and probably everybody on this panel and that's listening. I've had personal experience with my mother experiencing dementia, and coupled with my experience of mayor, particularly during the pandemic, where I just became starkly aware of the underserved nature of folks that are experiencing age-related illnesses. It's really kind of lit a fire under me and opened my eyes to the significance of this issue in our community. So I'm looking forward to learning on this panel, but also sharing hopefully some perspective.
Terrific. Thank you, Mayor. And that'll be part of our discussion, some of the personal experiences. But before we get to that, and Sherry, maybe this is an overlap, but I'd love to have you explain what steps Oakwood Creative Care has taken to help people who are suffering from dementia, because as I mentioned, the title of our discussion today involves innovative, and obviously what you're doing falls into that category, certainly. Can you describe some of it for us?
Yeah, so Oakwood Creative Care was established in 1975. So we're going on 49 years of innovation and serving seniors in our community. So with that, what we have found as we've been kind of pushing the envelope in how we offer care, the mission of our organization is to enhance quality of life and spark joy for seniors with cognitive and physical impairment. Quality of life is kind of a standard thing that we talk about, but joy is a little different. And we take that very seriously, actually. It's a super important component to the innovation and the model that we portray. So we offer what is called in the industry adult day health services. And so we have kind of shifted away from calling it adult daycare. The folks that come to our programs deserve more than being in a daycare. And so we call them day clubs. And in my 24 years of working in this industry, what I have found is that creative center of the brain doesn't diminish and is actually an opportunity to have a voice for folks. And so when you walk into our clubs, what you see is different from your standard memory care unit or adult day healthcare facility. So what you see is people engaging in fine art classes. They're doing lifelong learning classes. They're doing Tai Chi, Zumba, belly dancing, puppet shows, like you name it, and we're experiencing that, as well as music, choirs, jam sessions. So there is a lot of life and a lot of joy happening in those programs. But what we have found over the years in studying the different outcome measurements is that people were leaving our programs within 2 years of enrolling in the program. And so we looked further into that. Why is that happening? And what we found is that the families at home were struggling on the nights and the weekends. And so we started a search to find out what are the best practices happening around the world for us to be able to come around the entire family. And so we partnered together with the city of Mesa to create a dementia-friendly city in Mesa. And part of that was also partnering with administration on community living. And then we also received grants from Maricopa County and Mercy Care to allow us to launch the Dementia Hub. So for the last year, we have been really ramping up opportunities for the community to come together and create an inclusive community in Mesa. And it's been super successful. We're using evidence-based models out of Drexel University. We have memory cafes that have gotten so popular, we've reproduced them and have them going several days a week. So what we have learned is that there was another nonprofit in the Southeast Valley, in kind of the Sun Lakes area, who really struggled coming out of COVID. And so we acquired that location and have really worked hard over the last 2 years to implement some of the same practices we have in our adult day centers in Mesa. And that program has now exceeded the space. And so we are looking at acquiring a property in Sun Lakes and expanding to have a club and a hub together in one area. So that's our next step in innovation and expanding the model.
That's terrific. And there's so many things in there I want to follow up on in a bit, but I
Yeah.
want to get our other panelists involved first. Martha, how did AZ Complete Health get involved with this? I mean, I presume you're on top of all these things, but how did the relationship with Oakwood start?
Yeah, thank you. Yeah, so first of all, Arizona Complete Health has a really long history in managing complex populations in Arizona. So we've been the Regional Behavioral Health Authority for many, many years, and previously managed the Altex program, the Arizona Long-Term Care Program. And we've learned along that journey that in addition to our own care management programs, that building strong communities and support systems for our members with complex issues has really provided the best outcomes for those members. So peer and family organizations, supports, et cetera. So as we look to start the new Altex contract in October, we see a number of really parallel and similar kinds of needs, and we're really focused on a community-based model. So as we did a number of listening sessions, across the state, we heard over and over again the need for further development of services in support of dementia care, like Sherry has described. And we really saw the Oakwood model as a great opportunity for us to expand the reach and support for individuals with these kinds of needs. So Arizona Complete Health, we're part of the Centene Corporation, which is the largest Medicaid and marketplace insurer in the country. So in partnership and support of the Centene Foundation, which is an awesome charitable arm of the Centene organization, with Centene Foundation, we were able to provide Oakwood Creative Care with a $2 million grant to support the expansion of their model to assist in helping even more patients, particularly in lower income and rural areas of Arizona. So we're just really excited to partner with Sherry and Oakwood in the expansion of all of the services that Sherry described.
Martha, when you hear Sherry talk about that and how successful the model has been so far, how much could Arizona Complete Health and Centene do in terms of helping replicate it elsewhere and
Well,
expanding it?
Yep, absolutely. And that's really the goal here is with the grant from the Centene Foundation and in combination with AZCH, our goal is to partner with Oakwood in establishing other locations, as Sherry just described, right? Expanding the model in different, potentially different venues into other parts of Arizona, because that's really the goal, is to make Arizona as Sherry described Mesa as a dementia-friendly community. We want Arizona to be a dementia-friendly state. And so the goal is to expand and replicate into other areas of Arizona together.
Mayor Giles, let's go to you next, because obviously Mesa working toward being a dementia-friendly city and that being successful. What is the process of that like? Is that something where I do think when people hear dementia-friendly city, they have some general idea of what that's supposed to mean. But when you're actually doing it on the ground level as a city leader like this, did you have any doubts about it? Was something that once you learned more about the importance of this, that you wanted to jump in with both feet?
Well, I think that we're all evolving on this. That this is we need to change hearts and minds a little bit. I mean, when I had when my family had the experience with my mother, this was 20 years ago. And I'm embarrassed with the way that we handled it. You know, we thought that we needed to circle the wagons and burden, you know, shoulder this burden as a family, and the idea that the broader community was going to offer services, or that my mother, frankly, would receive better care if we looked for help outside of our family. That was foreign to us. And like I said, I wish that in the first few years I was a mayor of Mesa, I remember the deputy mayor Mark Mitchell and his dad Harry Mitchell, former mayor. They said, "Can we tell you how much we love Mesa because we come to Oakwood? We bring our mother and our wife, you know, to Oakwood, and it's made all the difference in our family. It's wonderful." And so and then I had another experience during the pandemic. I recall during, you know, remember in the early days of the pandemic, we were particularly concerned with folks who were that were older, that had underlying health conditions, and as a community, we really needed to figure out how to protect that very vulnerable population. And in the heat of all that, I remember going to a food distribution event one day, and it seemed like it was exclusively seniors, and they were wrapped around the building, standing inches away from each other. And in my estimation, it looked like they all had significant underlying health conditions. And I came to realize that we have this tremendous disconnected senior population that don't have families, don't have a social network, don't have any help at all. And so that was a real motivator, you know, an eye opener for me to say that we really need to rely on the broader community. We have to, I mean, we engage the faith community and the nonprofit community, you know, to try to, and the Meals on Wheels program. I mean, all of these things are very, very important and very, very underappreciated in our community. We need to really gather, you know, do all we can to be very supportive of them. So, to answer your question, Steve, to me, I think it starts with just this basic mindset that the best way to care for our age-related illness folks in our community is to look to the community, to try to lift the burden off of those individuals and their immediate families, because they really do, they'll get better care, and the families need help just as much as the seniors do.
And Todd, I want to have you talk about your personal experience in a bit, but before that, I think this is a good segue from what Mayor Giles said about engaging the community, because obviously as one of the great business leaders we have here, you're involved in that aspect of things as well, in terms of how a community can come together whether it's businesses or just somehow partnering when it comes to these things. But so can we talk about, before your personal experience, how important is it to engage business leaders around the community in this sort of thing too? Because we're seeing some world-class research here, obviously. How does that all blend in?
No, I think that's a really good point. And I think, you know, the Mayor Giles is correct, because, you know, I think so many of us really just didn't have a sense for what this was all about, and sort of tried to navigate this on our own. And now that we have people that are coordinated, that are talking, love the fact that Centene has decided we're going to invest in this. The city has decided they're going to make a commitment to this. And that's when you can bring in the rest of the business community and the broader community in general to really understand and support these kind of initiatives. Because I think the mayor's right. None of us can claim we haven't been touched by dementia. And the more that people understand and the more that people are involved and are given the opportunity to be a part of a solution, the better off we're going to be as a state. I will say I love the fact that you land at Sky Harbor Airport, and through the work of Mayor Gallego, we have an airport that's dementia friendly, and people know that coming in. Having a parent that I've had to take through the airport at the time we didn't have that would have been a huge thing for us to have. So this is a good example of how the broader community really can impact this issue and many issues in a big way.
Fascinating. Yeah. Martha, I wanted to go to you just briefly on that, because when it comes to finding partnerships, how much does that play into what Arizona Complete Health and Centene are doing as well? The idea that we have this growing community. I mentioned the research, obviously the care part takes number one. And when you have leaders like Sherry from a different angle, from Todd, from Mayor Giles, in order to make this expand even further in terms of the concept, how important is it to have buy-in from all these different sorts of stakeholders?
I think it's incredibly important. I mean, we've done a number of listening sessions across the state, and really, I think the key here is how do we weave together all of those various community partners, municipalities, et cetera, that can come together to be able to affect the best programs and outcomes for members suffering from dementia. So couldn't agree more on the comments that have been made, and how we bring that all together into partnerships is really critical, I think, as we look to what the future for dementia care looks like in Arizona.
In the course of our conversation, we're going to discuss some of these big issues and come back to them, but this is perhaps even bigger, but it gets to the really personal level. Sherry, as you mentioned, you've been involved in this sort of care and this sort of business for a long time. This is where I actually want to ask all of you to share as much as you're willing to about your personal experience. Sherry, how much did your personal experience lead you to want to get into this kind of care? Could you share some of that with us? What led you to it?
Yeah, so it really has been a journey for me. So after graduating from college, I actually spent a year in England, and I was with a program that put young adults in different social service agencies throughout the United Kingdom. I randomly got placed in a day program for adults with developmental disabilities, and it was an incredible experience and really life-changing. When I came back from that experience, I went and visited my grandmother, who was in one of the best skilled nursing facilities in the state of Arizona. And I was sitting by her bed a couple of weeks before she passed away. And she looked me in the eyes and said, "What are you going to do next, Sherry?" I was the third kid. Everybody was worried, like, the girl has a degree in recreation and art. What's she gonna do, And so I told her some crazy, lofty ideas, and she was like, "No, you have to work in a place like this, and you have to make it better." And my knee-jerk reaction was, "No way, that is not my deal. I'm not supposed to work with seniors." And I ended up looking in the newspaper for jobs and found a position in the West Valley as the day center supervisor for an early stage Alzheimer's day center. So I applied. I ended up getting this job. So I don't even know what Alzheimer's is. I have no idea what I'm doing, and end up in this role, and start really thinking back, like, what I had experienced in England was a day program. I'm now in another day program randomly, and it is not anywhere near the same. And what I started to recognize is here in the US, we are very fear-based. We're afraid somebody's going to fall. We're afraid somebody's going to get agitated. We're afraid we're going to get fired. We're afraid of all of these horrible things that can happen, to the point where we essentially put our seniors in a chair and have them play bingo and coloring sheets. We don't give them real paint. We don't give them real scissors. We don't give them real anything. We kind of strip away their rights. And then my dad called me as I was progressing in my career and said, I think something's wrong with Grandma Seal. Can you go out to North Dakota with me and just see what you think? And so I went out there, and Grandma Seal was doing the finances with my dad, and she was using the remote control instead of the calculator. And there were several little things like that. And I was like, okay, yeah, Houston, we have a problem. And so worked with the family to get some resources set up in North Dakota. Well, we ended up moving her to Arizona, and she was put into a memory care facility. So I broke all the rules and demanded that I was going to stay the night, her first night, in memory care. And at that time, you were supposed to drop your loved one off in the memory care facility and leave them for 2 weeks, no contact. It was supposed to help with their adjustment. And I said, no. So I stayed the night. They didn't give me a pillow. They didn't give me a blanket, nothing. But I was able to put myself in her shoes and realize what we're doing to our seniors is we're putting them in 4 walls with facades and locking them like they're caged animals. And we're wondering why we're seeing high levels of agitation, why we're seeing high levels of aggression. Well, think back to COVID when we were all pinned up in our houses. It didn't feel good, did it? Well, that sense doesn't go away when you have dementia. And so that night, people were coming in her room, wandering around, alarms were going off. And she looked at me. It was her first experience in seeing other people with Alzheimer's disease. And she said, Sherry, is that going to be me? Am I going to be just like those people? And so we had a really hard conversation that night. And I promised her that night that I was going to do everything in my power to help make changes in the industry and allow people to live their best life possible. And so from that moment on, I've been studying, like, why are the systems set up the way they are? Why can't we do this? Why can't they have a saw? Why can't they be using real wood? Why can't they be painting with real paint? Why are we just making them sit in front of a TV and waste away? These people built the community that we live in, and they're our grandparents, they're our parents, and they deserve better. And so we have been trying to push the envelope on changing how we do things and allowing people to live by their strengths and use the voice that remains. And it has been successful. We just completed a research project with Northern Arizona University and Huntington University. And there are indicators that the work that we're doing at Oakwood is actually neuroprotective. So a lot of times when we go to the doctor, we're hearing, here's a pill, good luck. And there has to be more. There is treatment beyond a pill. And we have to see these community-based programs as opportunities for individuals to take control and be able to live their best life possible.
Martha, I saw you nodding your head a lot during that, probably personally and professionally.
Yep.
Whichever way you want to respond, I think it's important to talk about, because obviously what Sherry's talking about hits a lot of us, but then also the fact that she's trying to take all these steps to innovate, which is obviously the major part of our discussion today.
Yeah, absolutely. So from a professional perspective, this is exactly why we chose to partner with Oakwood. We could not agree more in terms of community-based innovation that is going to really pave the way for how dementia care looks in the future for our members. That's really the ultimate goal here. So I can't thank you for sharing that story, Sherry, enough. That's again, that's why we chose to partner with you. But also just on a personal level, most people think of dementia and Alzheimer's as an old person's disease. My personal experience was when my sister was diagnosed with early onset Alzheimer's at the age of 58. So this incredibly successful professional, she taught behavioral psych at the university level. She was a school psychologist. And before she was actually diagnosed, she had done her very best to overcome and to hide her issues. It was really a very, very scary process for her and the family to be going through. It took the school district that she was working for at the time threatening to fire her for performance issues before she would actually seek help. And so we went through a really long period of her deteriorating cognitive abilities, just struggling to find the right kind of support. And gosh, if we had had an Oakwood, what an incredible, incredibly different experience we all would have had. She was an incredibly musical person, and so we just really kind of struggled to, I think, Mary, you said previously, you handled it so differently then than what you would do now. We did our very best to help contain her and keep her safe. Whereas now I think we would look at that very differently. And so we were really fortunate that her husband was an incredible caregiver for her, but he experienced many, many challenges along the way with not a lot of community support. She finally lost her battle at the age of 64, just 6 years after her diagnosis. So all of that is to say that on a professional level, I couldn't be more excited to be part of what we're developing in our communities. And on a personal level, I have an extreme passion for this in finding the right kind of support for those in need and for their families and caregivers.
Thanks, Martha. Todd, let me go to you on this. We discussed a bit about your personal experience. If you wouldn't mind sharing a little bit more in detail on that.
Sure, thank you. And like everyone else, a unique experience that shares, I think, a common theme. My family lived from, I think most people know, my parents were expats, lived for many years in South America. So, my dad came for an extended visit, and he was not himself. I think Sherry mentions agitation and maybe a little bit of anger, which wasn't like him at all. And he had always been very, very vibrant and worked till he was 82. And then one day he went to Target, and we got a call from Target saying that there was a gentleman who was lost and couldn't find his way home. And we thought there's no way that this is my dad. And we go down there, and yeah, he was terrified. He didn't know where he was. He knew who we were, but it was an overnight type of scenario for us. And like most of us here, we had no experience with this. We knew people that had gone through it, but certainly didn't know where the resources were. And in my dad's case, it was a very rapid development. And so we went from 0 to 60 very quickly. But like the mayor said, we circled the wagons and we tried to do the best we could. And I look back to the same kind of guilt, because we feel like we didn't do Dad justice. We didn't provide him what he needed. And because we just didn't know. And as you know, all of us here are people that certainly have resources to find solutions. And I could not find those solutions. And so we managed the best we could. And we lost Dad about 6 months later. And he was in a facility, and I almost hate to say the word warehouse, but it felt like we were almost warehoused there. And so that was certainly a very difficult time. My mom was a little bit different because it was much slower, but and that probably happened about 10 years later. And I think the challenge for us there is that she also suffered from mental illness, and she lived her life scared. So you can imagine living in South America, in Colombia, and having actual violence and things that are scary, but also having a mental condition that makes you scared. When we then got into the Alzheimer's side of things, that was a double challenge for us. And so we had learned a little bit. We knew where some of the resources were, but certainly from a longer term perspective, it became much more of a challenge. And I think what I love about this program and what the city's doing is that during the day, we couldn't, there was not much that we could offer her. And she longed to be with people. She was someone who always felt good when she could help people. And she couldn't, she was at home. And so thankfully, we were able to do to manage it to a certain extent. But Martha mentioned all text. I had to put Mom on all text. That was a very difficult process. And navigate that. And then finally, thankfully, for us, the Beatitudes saved saved my soul. I can feel good about things in that last year of life. But something like this would have been such a complete game changer, because when we were able to engage with her, or when she was able to engage, music, to Sherry's point, it changed everything. And so I'm a little sad right now thinking about how much this could have been an impact for my mom and my dad. But I'm really grateful that going forward, people are not going to have to go through some of the things that our families went through.
Mayor Giles, can I have you talk a little bit more about your personal experience, and then we'll have a couple more questions I'd like to ask all of you.
Sure. Yeah, I think I remember we took my mom home from my dad's funeral, and we kind of dropped her off, and we thought, okay, Mom, we'll be in touch. And it was only a short time after that, we realized our mom has dementia. Mom's not okay. And we had to, and this was, like I say, 25 plus years ago. And we just thought that, well, this is where our family steps up, and we don't want to put Mom, we want Mom to age, with her family, and we want to continue to experience all that she can teach our children and grandchildren. And so it was very well intentioned, that we came up with this schedule of rotating Mom around the 5 siblings. And in hindsight, it was a horrible plan, because it was a real hardship, frankly, on our families to do that. And because of that, she wasn't getting the level of care that she deserved. And so it like I say, 10, 20 years later, I found out, well, this is how you should do it. Of course, the family still needs to play a integral role, and to suggest otherwise is wrong, but you need to augment whatever the family can do or can't do with resources from outside of your family. That's what our seniors deserve. That's the respect that they deserve, that Sherry's talked about. My experience at Oakwood has been, I've got a beautiful art piece hanging in my office that was created by the folks at Oakwood. And when Sherry talks about your creative capacities continuing to improve with age, I'm looking forward. My artistic abilities are somewhat limited. My kids would always get A's on their art projects because I do them for them, and the teachers, because I was a good substitute for a 3rd grader in terms of my artistic ability. But I'm looking forward to developing that side of my talents as I age. So there's a lot to learn. I think that the thing that I would suggest is we just need, let's all be very humble about this situation, and realize that when we're confronted with this situation, talk to people, talk to experts. Don't think that you know what to do here, because you don't.
And Sherry, before I go back to you, I would one more question for Todd. And this is specifically, as we're trying to become more innovative when it comes to this kind of care, there's a growing need for trained, generally healthcare workers, but this is an even more specialized field. So Todd, let me ask you first, how is the community, the Valley, how is it doing in terms of getting more people trained up for this thing, and knowing that there's specialized care that's needed, both in terms of what Sherry's talking about, the innovations, but even at the basic level, to know that there are folks who when we are in a situation, whether it's a dementia hub or something in a longer term situation, that we really want to be able to trust where we take our loved ones. We're all going to be nervous and scared and probably feeling guilty, but you want to at least know that people who are helping care really know what they're doing. Are there more steps being taken around the Valley for that sort of thing?
Well, you make such a good point, and you're right. You can't imagine a scenario where you don't want the best care possible. And like we are hearing everywhere in Arizona, we have more jobs than people here in the Phoenix area, and in healthcare, that need is incredibly acute. I would say it's one of the biggest areas of need that we've got in Phoenix. When you think about even just nationally, and some of the trends we're looking at, it was expected that we're going to need millions and millions more healthcare workers in order to meet the needs as baby boomers start to age. Their needs are going to need to be addressed. Now, I think what's interesting about this and what we're hearing is that unlike the silent generation, they want to age at home. They're wanting to make sure that they're staying at home. So programs like this are going to be so important, but we're going to need to replicate this and take it to scale. So we're going to need to be training folks, starting to talking to kids, to, you know, to Sherry's point, in middle school and high school, talking about what careers are available, helping them with career pathing, so that once they get into the either a community college or a university situation, they're ready to go and get into the workforce, because we're definitely going to need more as the baby boomers start to age out. And then I guess all of us will be following. And I'll tell you, from my perspective, I'm listening to what Cherry said. Having two parents with dementia, I think about this, you know, that this could be me. And I hope that there's a Sherry out there, and that there are providers out there that my family can use when that, well, hopefully that time doesn't come, but it may. And I think that's just something we all have to think about.
And sure, you have such a unique passion, as we talked about, I mean, with what you came into. But as you also said, when you were talking to folks back in the day, you weren't sure this was necessarily the path for you, and yet it turned out obviously to be the best one. When it comes to getting the right people involved in this, and I don't mean, when I say the right people who really have a passion for it, will put the time and the energy into trying to create that joy you're talking about. How challenging is that training? Do you think there are enough people out there who, once they hear about innovative methods like yours, are going to want to get into this profession that perhaps wouldn't have before?
You know, what we're seeing is it's a lot of people who have had personal experience who want to help make a change. And so a lot of people are doing career changes to want to be a part of what we're doing. So it is a challenge for us. It's not a field that most people think, oh yeah, that's what I want to do when I grow up, right? It might just be my daughter, right? Because she's been raised around it. So, but we do need to start integrating these concepts. So Oakwood is doing a lot of dementia friendly trainings, and so we're trying to get into high schools and junior highs and get students trained in being dementia friendly and getting certified as that. And then we're also trying to connect with the business community. So we've partnered with like the Mesa Chamber of Commerce to do dementia friendly business designations. So that way we can start connecting with local businesses, so that when people go to restaurants, they can have an enjoyable experience. When they go to the bank, the tellers are able to understand what's happening and be able to work with those individuals better. So the education it's broad and it's deep, from the workforce to the community to students. And then we're also partnering with local universities to do clinicals and rotations to get those students exposed to what dementia care can look like. And there's a lot of light bulbs going off when they walk into the clubs of like, oh, well, this is fun. I kind of like this. And so that is offering us workforce pipeline, I guess you could say, as we grow and develop as well.
So we have an audience question. I'm going to throw this one to you, although if Sherry, if you have a response to this, that'd be great as well. Person is referring to the fact that Martha mentioned that Arizona has one of the highest dementia rates. Could this be due to retirees relocating here, or is it more of an organic reason?
I think it's the former. We have, first of all, just a growing population in general. Our population is aging, and we have a number of retirees coming here. It's such a great community to live in. So I do believe that it's more of the issue of just our growing and aging population, a number of retirees moving here. I don't think that Arizona is organically a different kind of community than others, but it is a dementia-friendly state, as we talked about, but I really believe it's really the former.
And Sherry, are there any other complications that come from this being a place that is so beautiful? I'll say, when I was a kid, 9 to 10 months of the year, now more like 8, but still pretty darn good. We have a lot of people who come here for 5 or 6 months, and many of those people have a second home here. Does that give Arizona a unique opportunity to be even more innovative in this? But are there pitfalls with that? The idea there might be people who come here and maybe they have a an incident or related to dementia, and they're not in a familiar place anymore. Are there certain things that can be done to soften that blow, I suppose, in some ways? And is that part of innovation potentially as well?
Yes. Yes, there are pitfalls to it. It does become more and more challenging as people progress through their disease process to be in an unfamiliar location. And also not having the community support. So, you know, a lot of times when they come here during the winter, the adult children aren't here. They don't have that infrastructure of their church community or, you know, their friends and family. And so it can be very isolating and lonely. But they also feel safer here, right? Because they're not going to slip and fall in the snow, or they're able to get out and enjoy life. And so I think that's where programs like the Dementia Hub become so valuable, right? Because they can come and create a community at the Dementia Hub. So it's a place for the care partner and the person with dementia to be able to build community, to come to a memory cafe, to come to paint and sip nights, or, you know, we have live bands that come in. So the idea is that it's just a safe, fun place to connect to resources, education, and support. And so I would encourage those that are coming here as snowbirds to really dive into those services that are available to them in the community.
Martha, we have a question about with Alltech's expansion, will there be an increase? Could there be an increase in dementia sort of related training? Could that be a priority?
Yes, is absolutely the answer to that. So I think that one of the things that we're really focused on is workforce development, specifically in the dementia space. So you know, I think it's a really exciting time for our universities and our communities in general around developing workforce training programs. So we've actually partnered with community colleges, Pima Community College in particular, to develop training to support aging and underserved populations. We recently provided them with a $500,000 grant in that area. And then one of our own team members, in fact, Tina Brown, was just honored for teaming up with ASU on the development of their community health worker program. So we're excited to help shape, with the support of the community, where we go with the development of educational programs to support the population, and particularly dementia and Alzheimer's support.
Another terrific question from one of our viewers. What kinds of programs are being offered as it relates to employers? Is that something, Todd, maybe you could talk about this just to see if you've heard anything about this, that when employees are going through something, you know, we think about family leave related to a newborn, but as our communities are changing and as our population is getting older, are there programs that are out there? Is there an increase? Is that something that has to be discussed at the federal level, for example, to get more opportunities for employees to take time off, or in trying to help care, either if they're caring for someone at home, or if it's just a matter of making sure they have enough time to help people when it comes to Sherry's program, et cetera, just to be able to get that time off and not be fearful of losing their job or being in trouble at work.
Right. Well, and certainly that's, I'm sure, something that the Family Leave Act would envision at some point. I think, you know, for us, the EAPs, the employee assistance programs that a lot of our companies have some resources that can help. I think, you know, for employers, I mentioned the fact that there are more jobs than people. Employers know that they've got to be flexible with folks. Aside from just being good people, you have to create that time for your people to be able to take care of their families. And, you know, we've been talking about this from a workforce perspective, and it certainly is. There's no question that there is going to be a deficit of people that coming into this field. But if you're not giving the opportunity and the flexibility for your folks to take care of their family, they're not going to be productive at work. And programs like this can ensure that can happen. So it's an interesting workforce question. Clearly, we have to develop more workers and get more workers in the field, but also you've got to protect people that are suffering from this through their families, and allow them to come to work and be productive on your teams.
Sure, you're sitting forward on that one. Does that mean you want to jump in?
I mean, it is a big issue, right? Like, I think there needs to be a larger conversation about this topic, and I think one step businesses can take is to become a dementia-friendly business, right? And just start low-level education on it, and then have opportunities for, brown bag trainings. And, we can go out and do those types of trainings at different corporations to help families get the support and education that they need, and to understand what resources are out there and available.
Martha, here's a question I think might be a good one for you. Are there connections in other states for services with values similar to those of Sherry's program? Are there possibilities of state-to-state partnerships on this sort of thing?
Well, I do think that there are. Arizona Complete Health, as I mentioned, is part of the Centene organization, and we actually provide Medicaid and Medicare services in 31 different states across the country. And many of those states actually offer programs not unlike the Altex program. And so I do think that as we look across markets, there's opportunities for connections on these special kinds of programs. I know that many of my counterparts are looking for organizations like Oakwood to partner with, and our Centene Foundation has supported many of those organizations. So I do think that there's many opportunities as we think about how can those connections be made? How can we connect the dots for snowbirds who come into Arizona, and connect with those different services that are maybe available in the other 6 months of where people live. So I think those opportunities are there. We just have to locate them, find them, and make those connections.
Martha, let me have a quick follow-up with that then, with all the great work being done at Arizona Complete Health, but in a more general sense, would you have any recommendations for the public trying to navigate all these things, whether where to find care, what insurance there could be, how much insurance pays for, all these sorts of things?
Yeah, it's a really complex issue. And so maybe I'll try to answer that through two different lenses. So through my organization's lens, we recognize how complex this issue is for our members and their families and loved ones to navigate. So our goal is really to partner with them on the journey, whether it's to wrap around them with care management services, providing or arranging for transportation, home modifications, respite care, doctor's appointments, connecting them with community-based services like Oakwood, education. I think, I'll comment because I couldn't help but notice that every single one of our experiences that we described, personal experiences, had some element of guilt that we had attached to it. And I think that as we think about what does the future of dementia care and Alzheimer's support look like, we really want to turn these kinds of conversations into something positive, where we learn how we can better help support our loved ones to live out their lives with joy, as Sherry mentioned. So I want all of us to kind of take that from this conversation, that there's positives that come out of these kinds of discussions, and we want to try to get away from the guilt that I think have all experienced. But to the point of the question, really, what are the other supports that are available to people in the community to help understand? So I think there's a lot more to be accomplished as we work with community partners. We're partnering with Centers for Disability Law to provide education on what types of benefits are available. So helping people understand the complexities of the Medicare and Medicaid system, and how those two sets of insurance coverage work together to provide the full spectrum of what's available to people in terms of their needs. So Altex has two different differences from Medicare, right? Where Medicare takes care of individuals' acute and short-term medical needs, the Altex program is designed to really cover long-term care. So Medicare is not needs-based. All-Tex is a needs-based program. So many people come to realize that their loved ones aren't covered for long-term care needs under the Medicare program. So what I would say is kind of pulling that all together, one suggestion I would have is talk to your insurance broker or a navigator or community assister like KEO or Helping Families in Need. And Chicanos por la Causa has really developed navigator functions to help people navigate what's the right thing. Is it the All-Tex program? Certainly what's available through Medicare. So I think those are the types of support systems. And of course, the Alzheimer's Association has a number of resources. You know, you talked about bringing, Sherry, you talked about bringing people in for education inside of employers. We just had the Alzheimer's Association come in and do some education for our own team members just to understand what resources are available. So those are the kinds of things that I would strongly recommend.
Thank you, Martha. We have about 10 minutes left in our conversation. Much of that's going to be taken up by some of these great viewer questions. But Mayor Giles, I wanted to ask you one. You and I have talked in the past about getting policy changes done at the legislature, for example, and that can be sometimes like pulling teeth. But local leaders like yourself and mayors and council members and whatnot are trying to make some of these changes happen. For example, when it comes to making a dementia-friendly city, are there things that you could think of that maybe at the state level you'd like to see, that you'd love to see the legislature take action on? Anything that comes to mind when it comes to policy that you've been able to do at the city level that you'd love to see at the state level?
Well, I can tell you that what's on kind of front of my mind right now is I was at a Maricopa Association of Government meeting 2 weeks ago and had a very sobering presentation on heat-related deaths last summer. 645 people in Maricopa County died of heat-related illness last year. The vast majority of them were seniors. And so it's this, we really have to have a cultural shift where we adopt our seniors. I mean, if there's a young child running around in a park or in a street, we all immediately jump, you know, and feel a sense of responsibility for that young child. We need to have the same sense of ownership of our senior population, because like I said, there's a lot of folks who have they're very disconnected. They don't have any resources. And unless the community steps up and says, hey, we're going to knock on your door, and if your air conditioner is not going to work and not working, you know, there's a community response to that. And I can tell you that's the case in Mesa. We have millions of dollars, and we have social workers through the fire department. I mean, we've got a safety net that we need to strengthen. But that we need to implement and let loose on this situation. So I would just encourage all of us to, it's kind of a cultural shift. You know, there are some cultures, Asia, Latin America, where they, you know, if you're a senior, everybody owns you, everybody takes care of you, you are brought in, and that's something that we need to get better at.
Did you have a quick comment on public policy aspect?
I think maybe the mayor is being a little humble, but perhaps for the state to look at the Mesa model and figure out how we can adopt something like this on a statewide basis. Because he's right, there are so many people, especially in the rural areas, that don't have the ability or the resources to take care of their family members. And if we at least decided as a state that we were going to shift that cultural perspective and look at seniors differently, especially those suffering from dementia, I think that could go a long way in terms of at least giving people some hope and some answers as they go through this journey.
Thank you. Sherry, from one of our viewers, what is a first step to assess what community services are appropriate when a loved one is showing signs or entering dementia?
So I would say accessing the memory cafes. So many of our cities are offering memory cafes at this point, and it's a free service that is built around that particular community. And so I would get involved in those and start building out your community where you live with people who are going through a similar journey. I would recommend tapping into whatever resources you can to stay active. The more we can keep the neurons firing, the more we can protect the brain And so, using music therapy sessions, going to an adult day club, starting that early will help the trajectory long-term of the disease process.
I thought this was an interesting question, and I'm not sure if this is something, Sherry, that maybe you can discuss, or maybe you and Mayor Giles as well. How much, if any, has this sort of program leveraged the Japanese Dementia Town model, which I'm not familiar with? Is it possible to partner with them as almost like a sister city to incorporate best practices? Sherry, do you know Dementia Town? Is that something you could give us a quick description of?
I don't know if I know that particular scenario that they're discussing. But we are always researching what's happening around the world. There are some really great models where people with early stage dementia are able to volunteer, or there are cafes that I think it's called like a mistakes cafe. Like, you're going to go to this cafe and you're not going to get the right coffee that you ordered because the person with dementia is serving you. And so those are all things that we are looking at and thinking about, but there's always a cost behind those types of programs, and not reimbursement rates or reimbursement models for it. And so that's the challenge that we as providers have. And where, I think Mayor Giles was humble. Like, what the city of Mesa does for Oakwood is they provide the space for us so that we don't have that overhead. And it's through grants and donations that we can provide this higher level of services. Because, like I said, the reimbursement rates and the costs that we charge families don't cover what it actually costs. And so that's the tension point that we as providers have, is being innovative with very, very, very limited resources. So it's cities stepping up and saying, hey, I've got some space available. How about we run this program here? Or, like Centene Foundation stepping up and saying, hey, we know we need a bigger location in the Southeast Valley. And so them funding that for us allows us to be able to do the work. So it really has to be the whole community coming around and having these discussions to make these things possible.
We just have a couple of minutes left, and I know we've all had a great discussion. You've all had great input, but I wanted to see, Martha, if you wanted to take 30 seconds and sort of wrap up almost the takeaway for you from this conversation, something you'd like our viewers to take away.
Well, I would just say, first of all, thanks for the opportunity to have this conversation. I think more of these conversations are really what will bring the community together, from a business perspective, from Mayor Giles, thank you for being here, because I think you're a perfect example of the things that we can export to other communities in Arizona, and just the partnership with an organization like Oakwood that we can take to other communities, I think is really the fantastic opportunity that we've had in terms of the conversation today. So thank you.
I'd not put you on the spot, but I'd love to have all of you just sort of give a wrap up as far as what you think is most relevant you want our viewers to take.
Well, first of all, thank you for convening this. I think this is a really important discussion. I think a few things, given that we're in the policy arena at the chamber, I would say this is a prime example of the fact that real serious policymakers are incredibly important for Arizona, right? This is not an Instagrammable types of policy issue. This isn't something that you can put on Twitter and have someone fight with you about. This is something that is impacting people on a day-to-day basis. So mayors like Mayor Giles, Mayor Gallego, and policymakers at the state level, we've got to make sure that when you're voting, vote for people who are going to look for real solutions in your life, not fake fights out there about nothing. And so I want to thank the mayor and also congratulate him on doing this kind of work. The other one is that you're not alone. And I will tell you, there are so many resources out there now that we didn't have before. And you'll reach out to people, make sure that you don't isolate and decide this is a family type of a scenario, because there are resources out there, and you're going to learn I've learned today things that I didn't know, and I thought I was pretty well schooled on this. So make sure you do that. And then the final one is, I think you've kind of given me my marching orders. The business community now needs to do something more. And I'd be certainly happy to do something with Sherry and Sally at the Mesa Chamber, along with the mayor and Mayor Gallego, perhaps with the business community, to say, all right, well, how are we stepping up? So we'd be happy to do that as well.
Mayor Giles, a few seconds before I wrap up with Sherry.
Thank you. I'm grateful for the increased awareness that we're creating around this topic. I'm proud of what we're doing in Mesa, but frankly, we're not doing enough. All of our communities need to be making space available for programs like Sherry's, and we need an all hands on deck, response to this in all of our communities. But I'm grateful that things are improving.
Sherry, I think in some ways you've brought joy to a lot of the viewers based on all this information you've shared and you're trying to bring to the patients. I know it's hard to wrap up in 30 seconds or so, but what's the biggest thing you want viewers to take away from this discussion?
I think this is a beautiful example that you are not alone, that the community is, this isn't a single person's issue. This is a community issue. And this conversation is just the beginning of the community rising up to come around you and support you in your journey.
This has been the Morning Scoop presented by the Arizona Capital Times, Navigating Dementia, Arizona's Innovative New Model. Thanks very much to our panelists, Sherry Friend, President and CEO of Oakwood Creative Care, Martha Smith, President and CEO of Arizona Complete Health, John Giles, Mayor of Mesa, and Todd Sanders, President and CEO of the Greater Phoenix Chamber of Commerce. Thank you all for taking part. Thanks to all of our viewers and all the great questions you sent in. I'm Steve Goldstein. Have a great rest of your day.